say that, lateral femoral cutaneous nerve. One of the areas that it gets entrapped is right where it curves around the, curves around the inside of the bowl of the pelvis, and then it comes through the inguinal ligament right at where the TFL attaches to the ASIS, right? So the front point of your pelvis. So that means when the TFL is tight or has a lot of tone in it, it sort of compresses that space where that nerve comes through. Now, to address that space, we're going to actually go to the nerve that innervates the TFL, which is the superior gluteal nerve. So the superior gluteal nerve comes out of the spine around your sacrum area and actually comes pretty horizontal across the glute as it wraps around and innervates the TFL up here, okay? So you'll know this is under tension because you'll get a little divot on your butt. So you can, her pants are kind of making it like that, but if I slide my hand, you see how it goes into the divot like real quick? That's her superior gluteal nerve. Fingers are going to be on the direction of the nerve, not super tight, not super deep, just pretty superficial. And I want to stretch the skin, which make sure it's not the pants. So I got to go a little deeper than normal. So I'm testing direction of ease. It goes out easier than it goes in, and it goes down easier than it goes up. So I'm going to go out and down and just hold that for a second and see if it starts to relax, which it does. And then I retest it. So I find the divot. You might notice that the divot goes away after you start treating it, like it gets less and less deep. And then I'll retest the directions again. Out, in is better now. In and down. So I'm going to go in towards her spine and then down towards her tailbone. See what it does. I feel sort of everything spreading out in my fingers. And then that's it. And you can do that 2 to 5 times. And then we'll recheck